Hello, I'm Arsha Vahabzadeh at CES 2016 at the Digital Health Summit Studio, and I'm with Chris Bergstrom, who's Associate Director of Digital Health at Boston Consulting Group. Hi Chris, how are you doing?
Good, how are you?
Good, thank you. You just gave a talk at the Digital Health Summit. Can you tell us a little bit about it?
Yeah, sure. What I was focusing on is where we are in the life cycle of digital healthcare, because it's not that old of an industry. And I put forth, perhaps it really got started and began getting traction 5 years ago. If you look at, say, Google Trends search for mHealth, if you go back before 2009, it didn't exist. The word wasn't there. But you look at 2009 and it takes off like a rocket. So I think it's just a good benchmark for where we really began to focus on digital health. But that was the last 5 years. And it was dominated, rightfully so, by crazy entrepreneurs that were passionate with ideas and willing to take risks and fail fast. And we're beginning to see some of those ideas actually prove out. And some of them are beginning to work. And they're needing to scale right now and reach a larger population.
So is there a maturity effect happening?
So I think we're seeing a maturity within an adolescent phase. So we haven't reached adult phase yet, but that's really where we're headed over the next 5 years, because a couple of things have changed in the last 5 years that have allowed us to begin to move to the next step. And I think the next step is about scaling digital healthcare. So a couple of the big changes. One, technology is dramatically improved. I mean, think about 5-6 years ago, we had no iPads, we barely had an iPhone. So just in terms of the ubiquity and the power of technology in our lives, EMR adoption was very low, now it's very high. On the regulatory front, we've gone from having no clarity, no guidance for digital health, to where the FDA's embraced digital health, is working very closely with industry, trying to figure out what should be there, and has laid out a lot of guidance. And that de-risks the situation for large companies. So when there's a clear regulatory pathway, they're more willing to come in. And then I think that the final two things that have changed over the last 5 years, number one is that the economic environment is a little more ripe for digital health. We're not quite there yet, but with moving to value-based healthcare and alternate payment models, they're a little more appropriate for digital health. And so we're getting close to that. We're seeing the investment community invest. We've gone from almost zero to $5 billion a year in investments.
That's a lot of investment. Chris, you're at Boston Consulting Group. Can you just give us an insight into what led you to work at BCG as the Associate Director of Digital Health?
It was probably two things. One, I really believe that at this moment in the life cycle, as I was referring to, we need to take the crazy startup entrepreneurs and begin to marry them up with larger capital, larger companies to begin to scale. That's not an easy marriage to have happen. I've worked on both sides of the house. I'm really passionate about getting these to scale. And at BCG, I have the opportunity to work with some of the largest healthcare companies and others, technology in the world, to begin to marry them. So that was number one. The second reason was BCG is going to market differently in digital health than we have historically done. So we're known for management consulting. We can come and help craft the strategy. What should you do in digital health? But we also have a digital ventures group that can build digital solutions. So we can say, not only here's what you should do, but we can help you build it.
Chris, where can people go to find out more?
So bcg.com.
Wonderful.
Yes.
Thank you so much for your time.
Yes, thank you.
Thank you. This is Arsha Vahabzadeh at CES 2016 at the Digital Health Summit Studio. Thank you.